The following training video was created by emergencyltc.org for use in Tennessee long-term care and skilled nursing facilities.
Hi, my name is Ashley Walker. I am a safety tech who works for the Office of Clinical and Research Safety here at Vanderbilt University Medical Center. During this video, we're going to discuss the differences between N95 respirator and surgical masks. We're also going to be discussing the different types of N95 fit testing kits, how to conduct N95 fit testing, and the proper techniques to don and doff N95 respirators.
The first thing we're going to speak about are surgical masks. Surgical masks are worn to protect you from large droplets such as influenza. These would be worn as well by patients and guests visiting our hospitals because they help with the amount of particulates being released into the air. These help prevent infections overall. Surgical masks do come in various sizes and styles. They can have ear loops, or they could have one strap. The main difference is that these are not meant to fit tightly to the face. So they cannot be used for airborne precautions or anything that's considered highly infectious. The next thing that we're going to discuss are N95 respirators. N95 respirators are used to protect us from small particles and infectious diseases such as tuberculosis, measles, chickenpox, varicella, or the COVID-19 virus. Whenever we look at N95 respirators, you'll notice that they come in various size, types, and styles. It is important that you are fit tested for an N95 respirator so you know which respirator will actually protect you while working with these kinds of patients and situations. When you look at an N95 respirator, you'll notice that it says NIOSH N95. That way you know that this is a standard N95 respirator to be used for airborne diseases. Unlike a surgical mask, these respirators will have a top strap and a bottom strap. They will not have ear loops like surgical masks, such as the one I'm wearing now. There are other variations of N95 respirators that would not be appropriate for you to use in these long-term facilities or nursing facilities for COVID. These are N95 respirators with exhalation valves. This means that your exhaled breath is able to escape the respirator, which unfortunately would put patients and guests at risk. You would not want to use an N95 with an exhalation valve, but use one that does not and has a clear filtering face piece. Before a staff member can safely wear an N95 respirator and be fit tested with one, they must be medically cleared. A medical evaluation will be reviewed by a medical provider who will indicate whether this individual can safely wear an N95 or potentially have restrictions with its use. Examples of medical questionnaires can be found on the OSHA website. So when you begin to do your very first fit test and have bought your kit, I want you to know that there are various different types of fit testing kits out there, and I'll be showing you one type. We always recommend that you follow any guidance and instructions offered in the kit's instructional videos or instructional booklets. The first thing that we're going to look at are the nebulizers, solutions, and hoods. Whenever you look at your nebulizers, you're going to have a bulb, a reservoir, which holds the solutions, the question mark piece, which enables the solution to be aerosolized, and then the actual cap, which would screw on and direct the solution into the fit testing hood. Depending on which kit you buy, you will get a saccharin fit testing solution, and a saccharin sensitivity solution. If you decide to get the 𝗏𝗏𝐵𝗏𝐺 solution, you will also get 2 containers of a sensitivity and fit test. The sensitivity solution is used to see if our individuals can taste saccharin. Not everybody is able to taste saccharin, so to ensure our fit test is viable, we have to do a sensitivity test to ensure that they can taste it. If staff have gum, candy, mints, or cough drops in their mouth, it may prevent them from tasting the sensitivity solution. They can rinse out their mouth with water to assist with this. The saccharin fit testing solution is the one that's actually used during the fit testing. It is 10 times stronger. Now I'm going to talk about the nebulizer setup. When you put solutions in your nebulizers, you really only need as much as necessary for the fit test. There are markings that show exactly how much you are putting in. This nebulizer will not spray properly if the question mark piece is not pushed in. You can test this by squeezing the bulb and seeing the solution aerosolize into the air. I will then put the cap on tightly, and now I'm able to squeeze in a direction for fit testing and taste testing. Also be given a declog tool. This tool is used in the question mark piece as well as in the reservoir to declog if the saccharin begins to crystallize. Your kit will also come with a hood and a collar. This device is placed over the head during fit testing to build up the fit testing solution. When using these N95 fit testing nebulizers, we do not want them to lay on their sides because they will leak. You can use various items to make your nebulizer stand upright. This is just one example. You can also use cups.
So the very first part of a fit test is we need to make sure that the staff member is prepared to be fitted. We want to make sure that they do not have any gum, candy, mints, or cough drops in their mouth so they can taste our sensitivity solution. We also want to make sure that they are clean shaven. In our situation, we do have a clean shaven face, and you do not have gum or candy in your mouth, correct?
That's correct.
All right, we can move forward with our sensitivity taste test. I'm going to squeeze my nebulizer to make sure that it is working properly. Wonderful. And before we spray this in the staff's mouth or breathing area, we want to ensure that they are not allergic to saccharin or Bitrix if you're using that solution. Are you knowingly allergic to saccharin?
No.
Excellent. So what I'm going to do is I'm going to put this in your breathing area, and I will go 3, 2, 1, breathe. When I say breathe, please breathe in through your mouth to confirm you taste the sweet solution. 3, 2, 1, breathe. Can you taste that okay?
Yeah.
Excellent. If the individual cannot taste the saccharin solution, you can try again. If they had gum or candy in their mouth previously, you can have them drink some water to help cleanse the palate. Worst case scenario, you can have them taste the stronger fit testing solution, but you need to make sure it's not directly in front of them, as it's going to leave a major aftertaste which could affect the fit test. We recommend spraying in front of them and asking them to move forward into it like this. I'm going to breathe, 3, 2, 1, kind of move into that. Can you taste that now?
Yes.
Excellent.
Since the staff has tasted the fit testing solution, we can move on to choosing the appropriate respirator. I have many various sizes and styles here, but I'm going to choose one of our one size fits most regulars to start with. When we look at our N95 respirator, anything that is bendable or formable will always be a nose piece. You would never have anything like this at your chin, okay? So what we're going to do first is we're going to grab onto our respirator. I would like you to put the 𝗀𝗲𝗄 mask over your face like this. If you have eyewear or other eye protection, it is helpful to move them out of the way next. We're going to start with our top strap. We're going to take the top strap and pull it back where it is angled up high on the bridge, kind of right there. There we go. Once the top strap is secured high on the crown, we're going to grab our bottom strap and take it all the way back, getting it on the neck. When wearing an N95 respirator, it's imperative that the bottom strap is on bottom and that the top strap is on top. We never want these to be crossed or in the same location together. As a fit tester, if you see cross straps, or if they are in the wrong location, have them adjust the straps until they are correct. I'm going to have you lift your top strap up about a ½ inch higher. Top strap. Perfect. When it's at a higher angle, it's going to stay on your face better when going up and down or side to side. When we form down our nose piece, we want to take our fingertips and push firmly, following down the bridge of the nose. Pinching techniques are not recommended. When you pinch the respirator, you are more likely to create an uneven bend or even a tiny air pocket at the top, which is detrimental to your seal overall. If you make a mistake, you can pull it out and reform by pushing firmly. Next, as the fit tester, I'm going to make sure that the respirator straps, seal locations all look correct. I'm also making sure that there's no hair or other PPE in the seal zone. Excellent. The next thing that we will do is known as a pressure seal check. This is done to determine if you have a good seal with the respirator. Pressure seal checks should always be done before using with the patient on airborne precautions or who has an infectious disease. I'd like you to sharply blow out of your respirator, kind of like blowing out a candle, and feel for leaks of air. As you sharply blow, you're feeling for air coming from the nose piece, sides, or underneath the chin. If you feel any significant gusts or blasts of air, they could even flutter your eyes or eyelashes. Make adjustments until you no longer feel air leaks. Do you have any significant air leaks at this time?
No.
If they do have significant air leaks, you can have them adjust their nose piece, tighten up straps, or even try a different style of N95 respirator. Now that the seal check is complete, we're going to tell them about the fit test and what they should expect and how they should respond to you. We are going to do 6 simple breathing exercises. Each exercise lasts for 30 seconds. This is a taste test, so please ensure you breathe through your mouth the entire time. The solution that I'm using is 10 times stronger than before. So if you taste something sweet during the test, raise your hand to let me know. I'll make an adjustment or we can try a new style of respirator. Does that make sense?
Yes.
Wonderful. Next, I'm going to have them carefully place the fit testing hood over their head where they can see through it. Here you are. Each exercise will last for 30 seconds. You can use a clock, a stopwatch, or a cell phone to do the timing. The very first exercise is breathing normally through your mouth. When I sprayed my nebulizer, I need to do 3 to 5 sprays. I know a spray is successful when I see the actual spray come out under the hood. If you're uncertain, pull it out and put it up against something dark so you can see it. Once 30 seconds has passed, I'm going to ask them if they tasted anything sweet. Have you tasted anything new or intensely sweet at this time?
No, I haven't.
Excellent. If they say they haven't tasted anything sweet, we can move on to the next exercise. We're going to breathe deeply through our mouth this time. 6 to 8 big breaths. During the fit test, when I spray this into the hood, I need to ensure the nebulizer is turned to the side. If the nebulizer is pointed directly at the respirator, we can force saccharin to be tasted, which we do not want. It can invalidate the test. So ensure it is going to the sides. All right, 30 seconds has passed. Have you tasted anything sweet at this time?
No, I haven't.
Excellent. You can breathe normally again through your mouth. This time, when I'm done spraying, you're going to move your head side to side as if indicating no. We want some good range of motion, almost like you're trying to look over your own shoulder. If the staff is uncomfortable or the respirator is hitting the hood, there is a hole at the bottom of the collar that you can have them pull forward to give yourself more movement room. Okay, 30 seconds has passed. Have you tasted anything sweet?
No.
Wonderful. This time when I'm done spraying, you're going to go up and down as if indicating yes. If necessary, pull that hood forward. Now, if anybody has any neck injuries or they have trouble doing this, it doesn't have to be very exaggerated, just enough to test the seal. Okay, 30 seconds has passed. The next thing we'll be doing is reading the rainbow passage. This passage can be found on the OSHA website where it can be printed or laminated. When I'm done spraying, please read this to me out loud. Go ahead. After the staff member has read the rainbow passage, we are on our last exercise. The last exercise, when we're done spraying, they're going to stand up, march in place while counting out loud to 20. If they're in chairs that have wheels, ensure that they carefully stand up. Now that the fit test is concluded and I haven't gotten any indication that they tasted something sweet, I'm going to ask once more. Have you tasted anything sweet during the fit test?
No.
Excellent. If nothing is tasted, that means that the respirator they were fit testing with is a pass. They can take off their hood and the respirator. Now that the fit testing is concluded, we want to show proper doffing of the N95. We're going to take off our respirator as if we got blood, bodily fluid, or we worked with something highly infectious. If you have eye protection or other PPE on, it's helpful to remove those first. Let's begin with our bottom strap. We're going to take the bottom strap all the way around the head, careful not to break the strap, and you let it hang. Then we will simply pull the top strap forward and away from the face. This way we can easily get it to red biohazard trash. Carefully watch the staff member to ensure they are doffing the respirator properly. Wonderful. When you have a staff member who has too much facial hair to wear an N95 respirator, we are unfortunately unable to fit test them, and they are not able to safely wear one. For this example, I will have them put on the N95 respirator so you can see where the respirator seals to the face and where facial hair should not be located. As we can see, his facial hair is sticking out of the seal of the respirator, which an N95 will not work appropriately if that facial hair is present. They must be clean shaven within that respirator seal to safely wear a respirator and be fit tested. When somebody has failed to be successfully fit tested with a respirator, the first thing that you can do is try a different style of respirator. You will start the entire fit test over with the new style. If somebody fails to be successfully fit tested with your offered N95 respirators, there are a few options. You can order some different types of N95 respirators to attempt to fit test them with. Unfortunately, if they fail all respirators available, they cannot provide any patient care that would require the use of an N95 respirator.